Research shows that African Americans and people of Latin descent suffer disproportionately from most diseases and have a shorter life expectancy. Some of the health disparities experienced by African American men include cancer mortality, about 50% higher than for white men, nearly twice as likely to die of a stroke than whites, 2 times as likely to have diabetes than whites, and nearly 6 times as likely to die of AIDS than whites. Eliminating disparities in health outcomes is an important issue and has become a top priority at the state and national levels. Are you concerned about your family's health? Then this is the show for you. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for Healthy Connections. Audrey Alexander, the Minority Health Liaison from the Florida Department of Health in Orange County, is here to discuss the general health concerns of minority communities in Orange County. Audrey, thank you for being here.
Thank you so much for having me.
As the Minority Health Liaison, what are some of the areas that you focus on?
Well, we really try to focus on several of the chronic diseases that are plaguing our community. And some of those will include
I know diabetes is a big one.
heart disease, stroke, as well as breast cancer.
Now, when we talk about minority communities, we're talking about African American and people of Latin descent?
Yes, we are.
So just to abbreviate for this conversation, Black and brown people.
Black and brown people, yes.
What is the biggest problem you have in getting those groups to pay attention to the very diseases that you mentioned?
Well, the problem that we're having, or not having a problem, but we really want to reach out to go exactly where they are, and to be able to speak their language, and to be able to bring programs and opportunities where they can most appreciate it. Sometimes we can bring other things to them, but they're not interested. It does not resonate with them. But when we hit that special spot with them, and then they're more engaged in becoming a part of the programming.
What are some of the things you have to shift? You said go where they are and speak their language. So let's take each population, like African Americans. In general, the church is a central part of that community.
That's correct.
So do you get involved in that at that level?
Yes, we go to different churches and get the pastor to buy into it, and usually we don't have a problem with that. And so we're able to let them know that certain programs are coming. Sometimes we will actually bring the program to that church. And so it's also a matter of the right timing, the right day. So what may be good for us is not good for them. You can have this beautiful program laid out, but if nobody shows, that's another thing. And so we understand that we have to get in their boat. It's about them and about what works best for them.
So let's talk about the brown community or people of Latin descent. How is that different?
Well, it's different because we realize with the diversity that's out here that we have to literally speak their language so that they can understand, because there's different jargons that both populations use that will engage them a little bit more. And so we're hiring more people who speak the language, and as well as who have the skill set to teach and bring those programs to them. And also when we're talking about nutrition, we're talking about the foods that they eat.
And for both cultures, you know, the food is just a basic part of the identity.
Absolutely, and it brings the family together, it brings the community together, and so we have to be very conscious of what we say and what we do in order to get the messages across that we
Are
need.
there certain portions of those communities, let's take for example men, that are a little bit harder to reach or to move into action in terms of paying attention to their health?
Yes, it is. And so the way we try to tackle that is to have men to actually do the training or the programming or whatever. And not only just men, but somebody who, whatever the age group is, so that they can have that connection and understand. One of the things that we've done as it relates to maternal child health, we've had some summits for pregnant and postpartum women, and we recognize the need to have their partners there. And so we developed a segment that's just for fathers only. You know, teaching them how to change the baby, teaching them about safe sleep practices, and how to be that help to the mother. And so there are no ladies around at all. It's just the men. So.
And do you find that with men the conversation changes when they see other men who are there for that reason? Do you use that opportunity to kind of sneak in some messages for them?
Absolutely,
absolutely. I just let the cat out of the bag.
but it's done by another male, so like no females allowed. You guys do your thing.
That's what you've been told that happens. So if we know there's someone in our families who maybe has not paid as much attention to their health as they should, what advice would you give them on getting them to focus more on that?
Well, there's so many opportunities for education. And so sometimes it's a matter of bringing them a brochure about what's going on, or bringing them to a community event where this particular issue is being talked about, and just having them trying to engage them in that conversation, and for them to see the importance of it. And then maybe someone who they're close to, someone who they can that they feel comfortable talking to, they may respect their opinions, getting them to talk with them so that they can make those changes. And oftentimes, unfortunately, if you see someone that's close to you that's having an issue, and you see the devastating effects of that, then sometimes that will prompt us to make some changes.
Well, what I'm hearing you say is education and meet people where they are.
Exactly.
Thank you, Audrey.
You're welcome.
Take care of your health. We'll be back. Stay with us. Orlando Health registered dietitian Nanika Ricketts Cameron, and she's going to talk to us about the importance of how healthy lifestyle can significantly impact your life. Thank you for being with us.
You're welcome. Thank you for having me.
What does a dietitian do exactly? I mean, we've heard of the profession, but how would you define it?
Well, a dietitian is a food and nutrition expert who is available to the general population to educate them on healthy eating and healthy lifestyle.
And how do you do that at Orlando Health? Do you have programs that you take into the community, or people can come to you?
Well, we do have a healthy lifestyle program at my clinic, and in that we educate families and children on how to conduct a healthy lifestyle, how to incorporate healthy fruits, veggies, water, exercise, sleep. It encompasses a lot of things.
The whole 9 yards.
Yes.
What do you find easier or more difficult in dealing with specific segments of the community that have, you know, traditional foods that they like, traditional ways of living, and who say, I'm fine. I don't need to change.
I see. Well, it's important to connect with a dietitian who understands your traditions or understands your cuisine. I may not be able to educate someone as well as, or who is Russian as well as a Russian dietitian, but it's important to kind of facilitate the needs of the patient. So, for instance, if you have someone who enjoys soul food, for instance, then I can educate them on how to better prepare recipes so that they're healthier for their family in general.
And I would imagine that's the same for any ethnic cuisine.
Correct.
Just finding ways to do it in a way that supports you being here longer.
Yes, definitely.
So let's talk about that. People have habits. You know, we don't want to change. If someone says, I'm going to try this soy milk, this almond milk, this, you know, there are more milks out there now than we know how to pronounce. What is the best and easiest way to introduce new and healthier foods?
So I recommend taking small steps. For instance, if you're not eating fruit on a regular basis, find a fruit that you like. You may not like every fruit out there, and it's okay. If you don't like apples, let's move on to oranges. But find something that you like and make sure you start incorporating that. And then once you get that on your belt, well, let's move on to water. Are you drinking enough water in the day? And maybe you focus on that. But I encourage my patients to focus on one thing at a time so that they can be successful with that and then move on to another thing that they can conquer.
What are the biggest issues people bring up for reasons they don't want to change?
Time.
Okay. Can
Time
you say
is-
more about that?
Sure. Time is a big factor for many of our families. We have working moms, single parent households, children who are involved in extracurricular activities, and it's easy to go through a drive-through. So I always encourage them to try and prep as much as possible. If you have a weekend off or if you have one day a week, let's use that day to try and prepare some healthy foods for the rest of the week.
It seems so confusing because there's so many options, you know, especially if you want to change your diet. You've got vegetarian and vegan and pescatarian and lacto-ovo. I mean, it's like you need to go to school just to kind of
Right.
figure out what kind of diet you have.
Yes.
Can you explain the difference? Let's start with vegetarian versus vegan.
So vegetarians typically do not consume meat, right? So they are lacto-ovo vegetarians that do consume byproducts of animals, so eggs and milk.
Okay.
And then there are vegetarians that do not consume those. So vegans have no animal products whatsoever. So
No butter.
No butter.
No, okay.
Some not even honey because it's made from a bee. So vegans are plant-based, all plant-based 100%.
So if you go that route, are there just as many dangers as being extreme on one end as there is to I eat meat, butter, eggs every day?
Yes, there are. Yes. And I see a lot of children say, hey, I want to be vegan, but then they just eat spaghetti, right, for the day. So it's very important that you're getting all of your vitamins and minerals. And that can be hard on a vegan diet if you don't know what you're doing. So it's important that you supplement. Some need to supplement with B12 if they're not getting enough from some of the sources that they eat. Also, calcium is an important one as well, making sure that they're having some type of milk alternative that is calcium fortified.
How do you know? Let's talk about supplements. Do you need vitamins? Do you need to take herbs? Do you need, you know, how much is too much? How much is not enough?
Right. Well, it's individualized, and I do recommend seeking the guidance of a registered dietitian to kind of guide you in that. I do recommend going to your primary care provider and just getting routine labs done. And sometimes that can point out something like a vitamin D deficiency or a B12 deficiency or an iron deficiency. So I do recommend taking those supplements when there is an actual deficiency.
So for someone who this is the first time they've even heard that they could access a registered dietitian, what would be the first thing you would advise them to do to start shifting the way they eat so that their health can move to a better place?
I recommend starting with some basics: water, sleep, exercise.
That simple? Is that simple?
That's simple. That's simple. Conquer one at a time. If you're not drinking enough water, start. Get yourself a bottle, fill it up, reach your goal for the day, and go from there. Exercise, start walking. go outside, do something that you enjoy.
So I don't have to start training for an Ironman
No,
competition.
I tell my patients, you don't have to join a gym. You don't have to do something extreme. Start with something that you like. You may like biking. You may like running. You may just like rowing. I don't know. Find something that you like and
Go get the
enjoy.
grandbaby and push the stroller down the
Exactly.
sidewalk.
It's as simple as that.
Little changes.
Yes.
Some of your biggest success stories.
Let's think. I would say yes. I did have a male patient who, who thought maybe more of the obesity problem was genetic.
Okay.
Until they actually tried some of the changes that we recommended. And he was a spokesperson for us, and I'm so proud of him. He has done so well. He lost quite a bit of weight, came out of the risk factors of diabetes and heart disease, and he's doing well. So I encourage anyone, you may have genes that work against you, but you can always do something to make your outcomes better.
Perfect way to end this segment. Yes. Thank you. We'll be back right after this. Make better choices and move. If you are of African or Latin descent in this country, the numbers unfortunately show that you're at higher risk for many diseases. How can we turn that around? Well, hopefully we found some ways to get you started on the road to being healthier and maintaining healthy connections today. We're glad you joined us.